made to Representative Rosa DeLauro. And this is from the National Education Alliance for Borderline Personality Disorder. And I'd like to say it's such an honor to have you come here and to make this happen, because your schedule was extremely tight. So thank you so much.
I apologize. I didn't mean to make a grand entrance in that way, but I literally did just get off the train. I couldn't get up here last evening. Congress was in session, and but got on the 5 a.m. Train this morning. It's a great way to travel. It really is. It was wonderful. So I want to just say a thank you to you, Dr. Axelrod, for your introduction, and I'm touched. I'm humbled by this award, and I want you to know that I take this award not as an acknowledgement for past work, but quite frankly as an inspiration to do more, to continue to advocate, and to raise awareness with the help of all of you in this effort. Dr. Hoffman, in your presidency, I thank you for your leadership, the vision at the helm of this organization. Steve, to be with all of you, with you and everyone here today. I am so pleased to be here to help to make sure that we get May off the ground as the Borderline Personality Disorder Month. This is a great start. Look at the size of this crowd. I was very proud and pleased to be able to participate in the effort and to vote the House resolution that designated May as BPD Awareness Month. And even though it is a relatively new diagnosis, borderline personality disorder is becoming recognized as one of the nation's most prevalent, serious mental illnesses. This is about people's lives. Behind the statistics are the stories of real people who struggle every single day. Individuals in the dark, and families in pain. And no one deserves that. BPD affects people suffering with the condition, and it touches their families as well. It has far-reaching economic costs and public health costs as well. Yet funding for research is 20 to 50 times less than that for other serious mental health problems. This is a condition that cries out for more awareness. I was so saddened to read that 10% of people with BPD take their own lives, that the condition often brings unstable or raging emotions, with a high percentage experiencing serious self-injury and substance abuse. But we also know that an accurate diagnosis is critical, that it is key to effective treatment, and that effective treatment is essential to addressing and to improving all of the other mental and physical illnesses that BPD brings. So the question is, how do we make sure that BPD gets diagnosed accurately and that patients with this devastating illness get the effective treatment that they need? First, as you know, this is an unprecedented and I believe a transformational moment in our nation's history. And that Congress is working quickly to pass comprehensive health care reform, something that our nation desperately needs. But I say to you that there can be no comprehensive health care reform in this country. That does not include mental health. We will have failed. We will have failed if it is not part of this overall effort. We are going to need your voices, loud and clear and as aggressive as you've ever been to make sure that this legislation contains the efforts that you care about and the illness that you care about. Last year, we helped to secure vital protections for patients with mental illness when we passed mental health parity legislation. I'm going to introduce a health insurance transparency legislation to ensure that consumers actually know what they're getting when it comes to their health insurance, to help them to choose coverage that will actually take care of them if they're seriously ill and make the insurance bureaucracy easier to navigate. I just want to give you assurance, my last comment to all of you. Please be assured of my willingness and my efforts to work with you as we look toward increased resources for research, to assist you, to help to promote your efforts as you work to look at, to unlock the mysteries of this illness, to greater understanding of the illness, and to explore the treatments that are necessary. You have my word to work with you shoulder to shoulder as we begin to try to work in this effort. I want to say again to thank the National Education Alliance for convening this 5th annual event and for all of you presenting me with this award. Most of all, I would like to say thank you for being here today, for focusing on this serious condition. I'm always in awe of the work that you do because we work on issues of legislation. This is not about roads or bridge or parks. This is about people's lives. And what you do in your work is you give the gift of life. Thank you very, very much for this honor. Appreciate it very much.